Hi, welcome to my whole body approach series where I explain different parts of the body and how it's connected and related to different aches and pains that you may be experiencing. Now so far I started out with the knee and I went into the ankle, and last time I went into how the front of your hip might be affecting lower back pain and even ankle tightness. Now today I'm going to be talking about the back of the hip. Specifically, I'm going to pick today your hamstrings. So your hamstrings attach back here at your sit bone. See that red part? So basically that's right here. And when that is tight, it will pull you down. And when you're pulled down like this, it changes your posture. And when it changes your posture, basically you can't do a functional effective squat. And when you can't do a functional effective squat, it means that you can't use the biggest body part muscle that you have, okay? So when you're able to squat, it's not just about like having a bar over your shoulders and you're doing an Olympic lift. Squatting is about being able to lower yourself into a chair, going to the bathroom. It's about being able to have that glute strength to basically, if you're standing one foot in front of the right, in front of the other, and you're able to do an asymmetrical squat down to reach down and pick up something off the floor. So a squat is more functional than you realize. And when you have that tight hamstrings making your butt tuck under, like you can't squat down like this. When you're like this, see how my knee juts forward? Then what happens is that, I'm exaggerating obviously, but what happens with that is that now you're overusing your quads and you're putting all this pressure on your knee. But if you're able to use your glutes and hip hinge back, but sometimes we can't do that if we have a tight hamstring. So today, what I'm gonna be showing you is how to do a three-dimensional hamstring release. So I know I might have you've seen this in previous videos before, but this is so important that's important enough to me to show you again, okay? Because it actually there's a lot of details to this, and in the beginning, the first step is just to take a deep breath and relax. And think of this as a movement pattern, not as a stretch. Because sometimes we're so tight and we might feel uncoordinated that we may not be able to do this exactly correctly. And I say that in very loose terms because there's no right or wrong. Because our bodies got into this place because of tightness and we just need to wiggle it loose, and sometimes it takes a while. So just think of it as putting your foot on top of something that's higher. I like to keep my toes up and my knees bent. And what I'm gonna do now is I'm gonna push my hips back. And as I do that, notice how my knee lengthens a little bit, but I don't make it all the way straight. I keep a little bit of a bent. Okay, and once I'm here, I'm gonna be turning my leg out and turning my leg in. So if you notice, my toe is pointing out, my whole leg is out, my whole leg is in, and I'm just doing this back and forth. Sometimes you may even feel a stretching in your calves, but I also want you to feel a stretch, a lengthening here. If you don't, again, it's totally fine. Just start the motion. And slowly you're gonna be able to learn how to tweak it as you gain more pelvic flexibility. And this is where I would love for you to reach out to me if you want to understand all the stretch better. You can download the PDF that I made for you, but even if you want to have detailed information on it, I actually have developed a video program where you can watch and learn all the details of how to do this, because depending on what kind of problems you have or where you're tight, there are many ways to tweak this movement to stretch different parts of the muscle. And I wanted to show you, it's important for the motion because there's actually different parts of the hamstring. that you might want to think about. So the hamstring is, like I showed you, starts here, but it actually attaches on the outside and on the inside of the knee. And in this Gray's Anatomy book, I always like to show people kind of where that is. And also, I like to show a picture where the nerves, the sciatic nerve runs. So if you look at this picture, so this is where the sit bone is, as I showed you, and your hamstrings attach here. See how it starts right here? And it goes down and attaches below your knee on each side. That's why it's important to do the hamstring stretch with your knees slightly flexed and not locked out. And then if you want to look at the sciatic nerve, how it courses alongside with the hamstring stretch. So sometimes if you have any kind of sciatic issues, like lower back issues, this will be also an important stretch. So this is why you'll be, as you listen to all the videos of this series, you're going to start noticing that I'm overlapping, right? So when I talk about the knee, I talked about the hips a little bit, and I talked about the hamstrings a little bit. And now I'm talking about the hip, and then I go back and I talk about having that hamstring cross the knee, because everything's connected, and that's the whole point. But the best way to digest this information is to just practice little bits and pieces, one step at a time. So try the hamstring stretch this week. Next week, try the calf stretch. The week after, try the hip flexor stretch that I talked about last time. Usually, tightness doesn't happen overnight. Tightness happens when we sit too much. Tightness happens genetically, but also with posture. Tightness happens with sports. What kind of sports and activities are you doing? So tightness happens when we're doing things over and over again in the same movement pattern. So then those muscles are worked, but because of the three-dimensionality of it, you're not stretching things in the different directions. That's why I wanted you to turn your whole leg in and out, because again, you're going to be stretching the inside of your hamstrings if you turn out, and when you pull your toes in, you're going to be stretching the outer part of your hamstrings. So all those things needs muscle memory to be super effective with it. But the goal is that if you start doing these over time, all these stretches become second nature. So I really encourage you to take the first step by downloading the free PDFs and learn what we teach in our physical therapy clinic, G3 Physical Therapy. Why this is such a fundamental piece for all our patients and our clients, because when you do these stretches, there's a whole body alignment that happens where you're taking pressure off of your joints so that you're reducing or even reversing wear and tear. And when you have everything aligned, you take pressure off of your joints and your muscles, they can heal or recover or get stronger faster. I like to talk about if you have a flat tire. It's not just about fixing the flat tire. The flat tire will cause all kinds of damage to the rest of your car. So just like this, one part of your tightness in your body can cause all kinds of issue to the rest of your body. So my mentor, Gary Gray at the Gray Institute, used to talk about how he helped a professional pitcher that had a shoulder problem, and the root cause of that problem was actually not having enough flexibility in his big toe on the other side. And he was able to connect the dots and teach us all the different biomechanics that happens with each joint, connecting those dots and how to fix that. And that's what I want to try to open that window and share with you guys, that just because you have back pain and you rubbed and somebody's moved your lower back, you've done acupuncture, you have mobilized that lower back, you've gotten massage, doesn't mean that you've looked at all the different factors. But it doesn't also have to be hard. You might think that, it's really difficult because you're asking me to move my whole body. Are you asking me to spend hours and hours to take care of all these different body parts. And I'm here to share that it's actually more efficient and more effective than you think, because these movement patterns, because they're asking multiple parts of your body to move at the same time, we're doing this whole body approach becomes more effective because we're able to get more done with one program. When I was in my 20s, I had lower back issues, I had knee issues, and I had foot pain, and I couldn't run, and that was so painful because that was one of my favorite things to do. And in graduate school, when I found this method, this applied functional science whole body approach, I use one program, I use basically one exercise protocol for my whole body, and it fixed all three things at once. And by the time I was done with this protocol of movement, not only were my joints happier, my muscles were stronger, and because it was designed functionally in a dynamic nature, I was able to strengthen my muscles enough to run a half marathon after 8 months of training, which was amazing because I have been struggling with this problem for years. So I hope that this gives you hope if you're having pains about all the things that's possible for you. And if you're local to Encinitas or Solana Beach, reach out to us. We would love to help you. If you are not local, I actually have an online program that may benefit you. Basically, I just want to be able to give you some hope and realize that your body has immense potential. So download the PDF, get started, get moving, and I hope that this video was helpful. Please comment below if you have any questions, and just know that I'm here to guide you. Thanks so much.